Dear colleagues, hello from Istanbul. My name is Professor Dr. Aslan Gokbuget from Istanbul. I would like to present today very interesting and educative case. So you're gonna see soft tissue management, immediate implantation, and CAD/CAM restoration at aesthetic zone. As you know, immediate implantation at aesthetic zone have been always challenge for implant dentistry. So now this presentation going to be discuss a lot of different uh, issues in aesthetic zone. Patient 51 years old, chief complaint mobility and malodor around the tooth number 8. So European classification is tooth number 1-1. So aesthetic demand moderate to high. So functional expectations, of course, yes. She's non-smoker and otherwise healthy patient. This patient came to me like this. As you can see here, there is some amount of recession and a small fracture and the mobility of tooth number 8. This part has been broken and the tooth, due to the mobility, patients feel somehow malodor around the tooth 1-1. So let's go back 11 years before. At that time, it was year 2008, this patient came to me because of the infection around tooth number 2-2. As you can see here, there were a fistula and the tooth has been root resection long time ago. Then the infection replaced. Then we discussed with the patient at that time and decide to extract the tooth. So as you can see in the middle, after the extraction, I checked the buccal bone wall and there were no buccal bone wall. So I decided to raise a flap and put in implant and the augmentation and restoration the area at that time. So I extracted tooth and I made a socket disinfection with my RBMIAC and NDIAC laser. Then I put my implant. Then as you can see here, I performed a sandwich augmentation. Then closed the flap. This is immediately after surgery and next day. This is post-op 7 days. So as you can see here, it looks pretty okay for when you see for 7 days. There was a lot of things I did. I made an extraction, disinfection, and sandwich augmentation, and in 1 week, as you can see here, it looks pretty okay. Then I did a temporary crown on it, then wait 3 months. This is the situation after 3 months. And my prosthodontist colleagues performed some ceramic restorations on this area. And this is the situation after 3 years after the operation. Implant prosthetics and the other full ceramic crowns. And patient came back after 11 years on this situation. There's some amount of recession. This is a 12 o'clock position. And as you can see here, tooth root resection have been performed long time ago, and there is some pin restoration on it. I discussed with the patient the situation and redo a fiber post or something like that, conservative restoration sounds not realistic at that time. Then after discussing the situation with the patient, I decided to extract the tooth and put an implant and perform a soft tissue augmentation at the same session. So this is the situation. You can see the fracture line on this occlusal view better, and as you can see, the fracture line goes beyond the soft tissue. So that's why I decided not to do another fiber post or something like that. This is immediately after extraction. So of course I checked carefully interproximal height of the bone, buccal bone plate. Patient relatively thin, has thin phenotype, so I decided to perform very conservative way a connective tissue graft as well at the same session. So after the osteotomy, I put my implants. My ISQ value is 72. It's pretty okay for immediate restoration. I always calculate the ISQ values because it gives me an objective information around my primary stability. Then I performed an envelope flap. I didn't use a vertical incision. Then I put my connective tissue graft. Now patient's ready to do our CAD/CAM restoration. So this is the situation after connective tissue graft. Now I will put my tie base and scan body, but before I do it, I want to check and try to understand the orientation if I'm going to do 2-piece or 1-piece crown. This is my connective tissue graft. So I put an impression abutment there, and it looks pretty okay because it stays on the palatal side. So it means that I can do 1-piece screw retain crown on it. So remember the influence of implant position on the socket healing. So on the left side, if you put your implants, like our case, ideally single in position, so you don't need soft tissue graft. But if your patient is thin type of phenotype, so I recommend you to do that. But if your implant positioned slightly buccally, you need definitely soft tissue graft. If you do your implants too buccally, I mean the outside of incisional plane, so it's definitely cause bone loss and future mucosal recession. So the conclusion is, in this study, implant position significantly influences the bone and soft tissue healing. So don't forget this. So check your implant position carefully. So this is our tie base and our scan body. Now patient now ready for scanning. So before the extraction, usually we took an scanning from patient. So after crown removal, another scanning. So bite registration, lower jaw, and some adjustments according the system you are using, trimming, and the system made an orientation and gives you a proposal. Usually we use this proposal, and if you don't fit it, you can make some correction and print it. It's ready to print, as you can see here. And This is after printing and glazing. This is IMAX crown and crown in. As you can see here, is slightly shorter than the other one because of the protrusive movement of the jaw. And this is the situation. Just patient before leaves the office. Check carefully your occlusion. You have to make sure that when the patient chewing movement or protrusive movement, it should be out of contact with the lower jaw. As you can see here, this is the situation before and after the operation. Now patient leaves the office like this. I want to focus the area. This is post-op 7 days. There's a slightly necrosis on connective tissue grafts. It's okay, but it has already started the blood supply, as you can see here, and X-ray control. It looks pretty okay. 3 weeks. Our connective tissue have already been vascularization now. So what we need is, we need to wait at least 3 to 4 months for the tissue maturation. This is 4 weeks, looks better. But when you compare the distal papilla, implant side, and the natural tooth side, we have already lost 1 to 2 millimeter papilla. I will come back to this issue. This is the initial situation before the extraction. And this is post-op 8 weeks. Tissue maturation is still on progress. So this is post-op 6 months. Now we ready for redo the crown on it. As you can see here, the tissue maturation and the vascularization of tissue, and we didn't have any collapse on the buccal side, but unfortunately, we have already know this situation. On the distal side, as you can see here, we lost some amount of papilla, but this is acceptable. And usually, when two implants come to each other, I explain the situation the patient. Even you obey the rules on the aesthetic zone, you know that you're going to lose some amount of papilla in this area. If you look at on the occlusal view, it looks pretty okay, but when we look on the buccal side, as you can see here, there's a discrepancies between the mesial and distal part of the central incisor. So this is pre-op situation. In the pre-op situation, as you can, as I explained it before, patient have already been done implants 11 years ago in tooth number 22. So in this situation, patient has already 1 millimeter papilla lost. Now we extract the tooth number 11 and put another implant here. Look at the papilla. This is before the operation, and this is post-op 6 months. So as you can see here, this is the natural tooth area between tooth number 21 and 22, and this is the papilla situation in between two implants. So if you are talking about aesthetic zone, I can say that it's not always a good idea to put two implants uh, next each other. So remember the classification. If you have a restorative environment is two tooth, like here 2-1 and 2-2, and proximity limitation is around 1 millimeter. So vertical soft tissue limitation in this case around 5 millimeter, and the tooth contact area is around 6.5 millimeter. But when you have a implant and implant position, in this case, in the proximal limitation around the 3 millimeters, but the vertical soft tissue limitation in this case decreasing around 3 millimeters. So it means that in the beginning, I know that the papilla height between the two implants is not going to be same as the natural tooth side. So you have to discuss your patient in advance, otherwise it could be a big headache to you. Yeah, this is the case. I hope you learned something from the case. For take-home points, don't forget that implantology is a prosthetically driven discipline, so you should always obey your prosthesis rules. And the primary stability is important, and avoid overload. And use your surgical skills and instruments only when you must. And of course, KISS rule. Please keep it simple. I hope you enjoyed. See you again. Bye.